Hi, my name is Olayinka Ajayi. I'm a hyperbaric medicine physician with Essentia Health. So I specialize in hyperbaric medicine. It is a kind of specialized type of care that uses pressurized oxygen to treat certain conditions and to heal wounds. So you have patients who have chronic wounds, which means that the wounds have been there for a long time. And some of those patients have diabetes, or they might have some problems with blood flow to where the wound is. And then we use the hyperbaric, which increases the oxygen level in the blood flow, and then so as far as 10 times what is normal, and that heals the wound because everyone needs oxygen to heal. So typically, patients that come over, initially, the first way that patients come is scuba divers who have the bends. That was the origin of hyperbaric, but right now, based on research, we have more kinds of patients coming over to see us. For example, if you have a patient that has carbon monoxide poison, they come to see us as a primary way of treating that condition. Or if you have a patient that has gas in their arteries, right? However, we also have, in addition to that, we have other kinds of conditions where hyperbaric oxygen is a part of the comprehensive treatment plan. In this situation, it's an addition to something else. So the example here is non-healing diabetic wounds, people who have compromised flaps, compromised grafts, or if you have a patient that has radiation in the past, had cancer, had radiation, and the part where the radiation was has injured now, so the patient has problems healing in that place. So we can use hyperbaric for that. I work with a great team of healthcare professionals. These are well-trained professionals. We have a robust group we have a hyperbaric and dive medicine trained physician. We have hyperbaric trained nurses. We have hyperbaric trained technologists. We call them HBO techs. And we also have a safety manager. So in all, we have a team that knows a lot about hyperbaric medicine. So after the treatment of every patient, we see that our patients get better and they have good quality of life. We see that the function gets better. And a clear example is when you have a patient that has a non-healing diabetic wounds in their feet or their foot, as the case may be. Some of those patients have been told prior to coming to us that they will lose that foot, they will need an amputation. But with hyperbaric medicine, you can actually preserve that limb. So you prevent a patient from having an amputation. And if you do that, that makes a huge impact in your life. Seeing the patients get better, it makes a huge difference. The second thing is the interactions we have with other specialties in the hospital, in Essentia Health. We see that when we interact with them, putting the patient front and center, we have better results. So the patients and the collaboration with other specialties is what comes to mind for that.